There has been lots of talks about Medicaid and health insurance across the nation. A lot of people are facing Medicaid cuts because of the big, beautiful bill. There are currently a lot of people in nursing homes that have been given notices that they will need to leave and find another residence to live just here shortly.
Going on the internet and saying, I'm okay with these Medicaid cuts because I'm an able-bodied person and we just need to quit expecting the government to give us handouts. Listening to the Trump administration saying that this is just about waste, fraud, and abuse, and refusing to read the bill. When your mama in the nursing home loses her Medicaid coverage and can't afford to stay in the home anymore, you're going to be sitting around going, what's happening?
People are going to feel how they want to feel, going to have their opinions. Again, this is affecting so many people.
60% of nursing home residents rely on Medicaid to cover their care. That is a fact. And Trump's new tax plan, it cuts their provider tax by 41%. This slashes how much support states receive from the government for nursing homes. That's a 41% funding cut. That is a fact. The American Healthcare Association says that 1 in 4 nursing homes could shut down and half of their staff will be eliminated. That's a fact. So where do these senior citizens go? Some might have family to take them in, but for others, this is the end of the road. There's no place for them to go. This isn't America first. This is our elderly last.
So now we kicking old people out of nursing homes. We just packing a bag and chucking up to do. That's what we doing now. Because that's what's happening. And the reason it's happening is because these states are not going to foot the bill.
We are seeing so many cuts. It is affecting a lot of people that receive Medicaid and Medicaid services, and it's not just one certain demographic or a certain group of people. The elderly is being impacted heavily right now at this current moment. So many people were so worried about the certain individuals that were receiving Medicaid and that they weren't thinking that it was going to impact themselves or their neighbor or a close friend or family member, and that's exactly what's happening. People that, might have received Medicaid, they didn't think they would be affected by what's going on, and yet here they are.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah. I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, What we're going to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
Look at me right now. Look at me, how many sicknesses that I have. We got all in the fields. Where else? I feel like these stubby nuts in the back, But why? Why when we put food on their tables? Trump promised a lot of things. I thought it will be more family values and those programs that we really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country. Irma isn't the only one in District 22 who feels betrayed by the administration's plan to gut Medicaid.
The only people that are hurting are those poor people that really need the stuff.
They're making out big time with this, but they're hurting people in the process.
Not only sometimes you have family members that, are not equipped or not able for whatever reason, no judgment here, to have that loved one in their home. But a lot of times what I've seen is people will drop their loved one off at these, residential care facilities, nursing homes, and they don't come to visit them. I can say a good percentage of those individuals, once they reach that nursing home, that's it. As sad as it sounds, some people just drop their loved one off at these facilities like they're a piece of trash. They don't come and check on them. They don't call to see how they're doing. They never drop by. And it's just sad to see. So I just feel so bad for these people. I mean, one facility might be open this month, and 2 months from now, they may be closed. Also, keep in mind that we are seeing doctors and nurses that are losing their jobs.
They have cut 3% of all reimbursement rates for all services. That's healthcare, behavioral health, long-term care, nursing home care, child care, all of it. Everything got cut by 3%. But that wasn't enough to work with the budget that was given to them by the General Assembly. So they have a $319 million budget shortfall. So many programs also had an 8% cut instead of 3%, and some programs had a 10% cut. Here are some examples of the programs that had 10% cut. Inpatient healthcare stays, outpatient hospital stays, nursing home care took a 10% cut. PRTFs, psychiatric rehabilitation treatment facilities. I really need you to know those residential facilities, I said rehabilitation's residential, those facilities house individuals who have often cannot live on their own, have high levels of violence, and they're individuals that need high levels of supervision, medication, and support in order to be successful at all. And we cut funding to those facilities. Good call. 8% cuts to things like outpatient treatment, physician care, specialty doctors got 8% cut to their reimbursement rates as well. Cutting the reimbursement rates is going to cause problems. Not here in Wake County, where I work, and not in Durham County, where I live. It is going to cause huge problems to the rural communities and counties here in North Carolina, in places where they already didn't have enough doctors, nurses, psychiatrists, therapists, all of those things. That there already weren't enough of those people in those areas to provide services. Now those individuals will no longer be able to bill Medicaid. It is also worth noting that roughly 3 million people are on Medicaid services, and most of that is spread out throughout the state. And a lot of those people are children.
I'm going to go ahead and wrap this video up. You guys let me know how you're feeling down in the comments below. Let me know if you or anybody else in your family has been impacted by these cuts, or if you have a family member in a nursing facility that is potentially, looking for a new home or a new place to stay. Thanks so much for taking the time to watch. Take care, stay safe, and I will see you guys in the next video.
They will not be touched.
Yeah, I mean, I have said it so many times, we're not going to touch it.
The yeas are 218, the nays are 214. The motion is adopted.
This bill represents the largest cut to Medicaid in American history. It will devastate vulnerable populations.